So you work in social services and you work on a van. Talk to me about what you do today.
What I do on the van?
Yep.
Okay, so emergency services patrol is that I just sort of a first responder. Our priority calls are police, fire, and emergency rooms at hospitals. And we deal directly with people who, well, various kinds of situations and people, but the primary purpose of the emergency services patrol when they began was alcoholics, late-stage chronic alcoholics who frequent the same places in town, pretty much, same folks. We pick them up and transport them to the sobering center. Also, we take people who are in emergency rooms at hospitals to the crisis solution center so mental health professionals can work with them towards finding a baseline. We take people from emergency rooms at hospitals who have been connected with a social worker. Every emergency room has one. If you go in and you're strung out, maybe on fentanyl, maybe on whatever, it doesn't matter the substance you're in, you want to kick, alcohol, they have a social worker in every emergency room that can connect you with a bed in a treatment center. So you can get either 3 to 5 day detox, let's say, somewhere like Valley Cities, or a more lengthy inpatient treatment program at, let's say, Valley Cities or Turning Point, CMAR, and so on. So we transport, mainly what we do there is transport people who are with substance issues, mental issues, and sometimes physical issues. We have one wheelchair van and 2 other vans that are people. We work in teams of 2. We take calls dispatched by the police radio and a cell phone.
So when you first started talking about it, you said that this was originally, it originally focused on serving folks that suffered from long or late stage alcoholism. And so it's changed.
Yeah,
and
big
so
time.
how long have you been working in that?
6 years on the van as an on-call for 4 or 5 years, and recently I got hired full-time career service.
Okay, and so over that 6 years, have you seen a transition or a change in what it is that you're doing, or the people that you're serving, and what you've seen in the community?
Definitely.
Okay, are you at
going down
liberty to talk about that at all?
Sure. Going downtown, we used to go to some very regular locations where usually my perception of where we usually would go is Victor Steinbrook Park, Beacon and Bayview up on Beacon Hill, or 3rd and Pike. And almost all the locations where we go were places where people would gather who were late-stage chronic alcoholics and could buy cheap and high in alcohol content, beer, malt liquor, whatever it is, and hang out together. And so that was where it was at when I began, which was 2018 on the van. So we would pick up people, and the sobering center at that time was a lot more, for lack of a better word, efficient. It was they had workers there from Reach, outreach workers, case management, and they had a building down there by the Recovery Cafe where people could, they were very regular and in and out, so the system wasn't really directing them towards real success, but they could get into real success in that getting sober, I don't think. I'm not sure what will help. It was all about harm reduction again. But they had a case manager that would get people in places like the Wintonia or 1811.
Which are wet buildings.
Which are
wet buildings. Do you want to talk a little bit about, because you worked in Wintonia.
Alcohol management programs,
okay.
Yeah. So methadone for alcoholics, basically.
Right.
So yeah, I went to work, I think the first one was DESC. I'm not sure what year it was. Worked for them for a couple of years, and then into Catholic Community Services for another 2 or 3 years. Became a case manager, worked as a resident support staff in the beginning, became a case manager, left there, went to Lehigh, or Low Income Housing Institute, and worked with people, not a wet house, not an alcohol management program, because I had reached a point where I felt like I was enabling rather than helping. In the beginning, I thought I can help. I thought when I got a little bit of clean time, I thought I could help others get clean. I thought, like many of us do, I thought I could go into become a chemical dependency counselor and so on. And I had a friend that worked for DESC that I met at a meeting, and he said, "Why don't you just work where I work? You're not going to get paid any more or less. It's about the same kind of thing, except you get to help people on a one-on-one." And that appealed to me. And I was insecure that I could go back to school and get a degree in anything anyway. I didn't think I remembered enough math and so on. Pardon me. So I went to work for DESC in the beginning. The problem that I had with both 1811 and Wintonia, DESC and Catholic Community Services alcohol management programs became that I felt like an enabler after a while. In the beginning, I thought it was an assist. I can help these guys through a hard time and that sort of thing. But also know that it was selfish to some degree, because working with folks on that level of desperation and or the disease and that depth of the disease has been conducive to my own recovery, because it brings home the fear that I have of ever going back to that point again. And it's a daily reminder that's where I could be so easily. And so it's not all benevolence that I worked there for, but after a while I did feel like an enabler, and I was more involved in 12-step program of Narcotics Anonymous. So it was like, on the one hand, at meetings and in step work and with the sponsor and in service work, we're talking about the therapeutic value of one addict helping another. And all we want to know is what you want to do about your problem and how we can help. And that, on the other hand, in my job, we have a refrigerator in the back. Here's a guy that's peeing all down his leg and cussing you out and going into a seizure in front of you at the desk, and all he wants is you to go back to the fridge and get him one more beer because that's the program he's on. And so I began to feel kind of like an enabler. A lot like an enabler. And that wasn't very comfortable feeling. So eventually I left the alcohol management places, but
you stayed in the field.
But I stayed in the field, and the...
Do you feel like it's a vast field?
A vast
field of similar approaches?
I feel like it's pretty vast. But I don't think that I felt much different in terms of whether it was alcohol management or just housing first.
Can you talk about that a little bit? What do you mean by that?
Well, I'll give you an example of what I mean by that. So I worked at Lakefront Community House in Lehigh for about 4 years from the time they opened. And so our original guests there, if you will, came out of the park behind it, Bitter Lake Park. These were people living in tents and out in the elements and so on, living in tents and so on. So the first people that came in there were from there, and it was kind of off the hook with the behaviors and all the stuff that went with it. And
I'm just gonna ask you to just tell me what you mean by that.
Well, I mean by substance and by the relationships and how so the
people that moved from the park that came into the building were on
not much changed.
And so,
oftentimes,
just for audience purposes, you have mentioned housing first. And so, what is housing first?
Housing first, harm reduction is part of that whole harm reduction thing. If we get the optics of people, a big part of this whole thing is even a blind man can see the optics aren't good. And when you go downtown Seattle, it's changed a lot since 1975 when I first came here. So we must do something about it. Is the thing you hear over and over again. We got to do something about this problem of homelessness. But it isn't just homelessness. And when I talked about being an enabler at the alcohol management, why it's similar when I went on to just a place with no alcohol program is that the same clients would get housing, and I started giving an example.
And I interrupted you, sorry.
I'll give her a name. We'll call her, it's a fake name, Jane Doe. So we send Jane Doe's been there for 2 years.
Yeah.
our good friend that we talked about earlier had been there for 3 or so. So no change. No change is happening here, at least visibly. And so we get this one girl, Lehigh has a new apartment building. They send her to the new apartment. All she has to do is fill out the paperwork and stay there. Send her in an Uber over there. She turns around and comes back on a bus. I said, what happened? She said, I can't do that. I said, why not? I said, well, it's $50 a month for rent. How am I going to do that? And so the missing elements of what these places, nonprofits, are trying to do with housing first is they're not...
Housing first, just to go back to that. So housing first, and I'll just say it, is the idea that if you put people into housing first, then their life will improve sort of automatically, sort of a natural progression of improvement.
Well, I didn't say that
well,
that's
what the policy says.
Yeah,
so that's the idea behind the policy. And I know because I have also worked in the field, but that is the idea behind the policy, that there will be sort of a natural progression toward an improved quality of life for the individual.
Right.
So,
however, what I have come to believe is that without assistance, for the person who has been living in a tent or an RV, or who has been in housing in a transitional housing environment for a while, the navigation from there to successful living within a community, in a social situation, and or to navigate the finances, the substance, that I believe substance issues and mental issues are inherent with this homeless problem. And until you have somebody helping them navigate through all those things, they'll never get as far as successful living in the community and housing for very long, because the tendency appears to be to revert back to what you're comfortably uncomfortable with.
And so that brings up another question for me. So as a service provider in these different sort of similar but different substance-based housing programs that you're talking about, there's no training protocol for staff to work with individuals that are coming out of tents and off of the streets. And with that being said, what are typically the time frames that people have been on the streets? So because if a person's life is supposed to improve.
Let's talk about training protocol. The first, that was an interesting word, or a couple of words.
So there's no kind of training, no kind of tutelage to support the individual coming off of the streets to help them progress.
Training for that person?
Yeah. So for example, any kind of sort of skills training, because I'm guessing that people have been homeless sometimes for a period of time.
I don't know of any.
So having an expectation for a person to know how to navigate anything would suggest to me.
I thought you meant for the employees.
No. I mean the person.
I'm going to talk about that. Yeah.
Well, we can talk about that too, but no, I'm talking for the individual that's coming out of the tents. I mean, are they being sort of, when they come into these housing programs, are they then entered into sort of a skill building process to help them navigate these things?
Not that I see.
Okay. Nothing that you've been trained to teach?
Nothing that I have seen, no.
Nothing that you've been trained to teach.
No.
So talk about the training for staff. You as a lay person that comes in and gets a job at a place.
Like I said, I've worked for DESC. These are large nonprofits here in the Seattle area.
So what does DESC stand for? Downtown
Emergency Services Center.
Yeah.
Catholic Community, CCSWW, Catholic Community Services of Western Washington, Lehigh, Low Income Housing Institute, and King County on the van. But the housing first harm reduction model is what seems to be is the popular mode for getting people off the streets these days. So I've worked for all of those, and no, the training is minimal for the staff.
How many staff that you've worked with in these environments come from the same kind of background as you? Do you find that most do?
Most, but not all.
Okay.
Yeah. Some are persons like yourself, somewhat in that they're in school. They're taking a social protocol, a social a regimen in school of some kind, and so it's a part-time job to kind of see where they fit in, learn more about it, whatever.
Yeah.
Most, I think, are people like myself, I'll own that have some background.
Or twins, by the way.
Who else has more compassion and empathy for somebody in that boat than somebody who has also been there before? So I think that it's appropriate that people have lived experiences that are working with people in that situation, for one thing. But most, but not all. It's the answer to your question anyway.
Do you feel like you personally could have made more of a difference had you have been able to kind of be more, I don't know if this is the right way to say it, sort of freelance in your approach? And what I mean by that is that I know that each position they have contract requirements associated with it based on what funders say for these organizations. And so did you ever feel like you could have potentially helped somebody improve their quality of life differently had you have just had the autonomy to do so?
Yeah, I probably did. I think I have. But that may be perceptual too. I don't know that I have. I think that I could help people, but not always are my thoughts right. I think that what they're doing is well intended. It seems to be well intended, but I think that every one of those organizations that I mentioned are mismanaged badly. I don't think there's enough training, and so they're not designed, well planned out, or designed, in my mind, to be successful at what their stated goal or mission statements are. That's what I think.
Yeah.
But what else do we do? Just, I don't know of anybody who's got a better plan. At the same time, I sure don't see the one that we are using being successful in the long run.